and again, greatly appreciated. And as everyone who's a regular with the HITLAB monthly meetings that we have here on digital health evidence and digital medicine, everyone knows Don Jones, of course, and all the good work that he's done, and not just in the digital health ecosystem over the last 30 years, in terms of helping form it with a lot of what Qualcomm and the Jacobs family did in the San Diego County and Silicon Beach area. But they also know him as an incredible board member. He sits on I can't keep track anymore. It used to be several, then it was a dozen. Don, how many boards are you sitting on these days?
8 boards. And
8. Oh, it's gone down to 8. Okay, good.
8 advisory boards and 8 boards of directors. So 16.
Okay, so we're over a dozen. We're at the 16. That's outstanding. We'll call it instead of the Baker's dozen, it'll be the Don Jones dozen. So anyway, that's a impressive list. Nonetheless, everyone who's done board work before knows how much time and effort that takes. And then we have Dr. Jenny Lin, again, a tremendous ecosystem leader within the New York metropolitan area and nationally in internal medicine, and from the Icahn School of Medicine at Mount Sinai here in New York City. Jenny, welcome as well. Thank you for joining us today.
Thank you for having me.
And I think let's first start off with a little bit of backgrounds on each of you. Don, most of the folks know you, but if you could just do kind of a short overview on yourself to start with.
Well, just the short story is I built a couple of multi-billion-dollar nationwide health companies. Many of you know as American Medical Response and/or MCare, which is the largest medical group in the United States, before spending 11 and a half years at Qualcomm building out their healthcare efforts and business models and investment vehicles through 2 venture funds. And for the last 7 years, I've been doing board and advisory board work all around digital health in many different flavors. I'm also the Chief Digital Officer with Eric Topol at the Scripps Research Translational Institute in La Jolla, where we established the very first clinical trials program focused on digital health now well over 10 years ago.
Fantastic. And Dr. Lin, if you could also, a quick overview of your research.
Sure. So I'm a professor in the Department of Medicine at Mount Sinai and work as a primary care physician, clinically taking care of patients in East Harlem as well as the South Bronx and the Upper East Side in New York City. My work from a research standpoint primarily focuses on cancer survivorship and chronic disease management. So many of the outcomes are in the primary care space where I work clinically and help patients think about how to better manage their illnesses through behavior such as medication adherence, as well as diet and exercise. I have a clinical teaching role at the medical school as well and in the graduate school.
That's fantastic. Let's dive into that a little bit about some of the intelligent medication platform usage you've done. And if you could, for a little bit, detail about how you use intelligent medication platforms for medication adherence in your research.
Sure. So many of the things that we are focused on is how to best measure self-management behaviors. And one of those is medication adherence. And so there are numerous scales that have been used to capture patient-reported medication adherence, but it's often hard to actually do an objective measure. And so we have used certain types of medication bottle caps that give us an electronic read for whenever the patient opens their bottle, and that allows us to more objectively measure how patients are taking their medications, how often they're taking their medications, whether they're taking their medications as prescribed, and gives us a better sense of what their true medication adherence is like. And so we've used that for a number of our prospective observational cohort studies to better understand, again, these self-management behaviors like medication adherence for cancer survivors.
That's fantastic. And so when you're using intelligent medication technologies, how has that helped improve the efficacy of your research?
Well, it really gives us a really good objective measure of what patients are doing. Patients in general want to do what they are told to do, especially if you're in a research study and there is a bit of a social desirability bias of wanting to say that you're taking your medications the way you are, just like I tell my dentist I floss before I go see them. So, the medication adherence bottles, that digital technology really allows us to truly measure what's going on and allows us to, corroborate to some degree what patients say they're doing versus what we can measure that is being done on a day-to-day basis.
That's wonderful. And Don, from your experiences in clinical trials and all the numerous digital therapeutics and digital adjuncts that you've worked on over the years, tell us a little bit about what you've seen with these sorts of intelligent medication tools and their importance in clinical trials.
Well, so I've got an interesting background because I'm a lawyer and business guy by background, but I've actually been a PI on a Sanofi trial. And here we instrumented the patients with wearables that were taking Synvisc or getting Synvisc injections in their knees, essentially before, during, and after. And the interesting outcome of that, besides collecting a lot of data, was actually unexpected. The first interesting outcome was that the fact that the patients actually relayed to the physicians that the physicians were doing a better job because they had instrumented the patients and were not just asking, how do you feel? And the patients actually recognized that the more objective measurement caused by the wearable was actually an improvement in the process. The second thing that happened that was unexpected in that particular trial was that the physicians realized that patients were making referrals to friends and neighbors because of this. And of course, that made the physicians happy. It frankly made Sanofi happy. So this was an interesting example where we used an instrumentation in a trial, and the two most significant outcomes of that trial were not in the endpoints. They were actually in those two discoveries. That was perhaps a surprise. It was also a surprise to me that I was a PI on a study. Now, we actually had some good clinicians in there with me, so I couldn't screw it up. But the second trial that I was involved in designing was for Genentech. It was unusual. Genentech had a cancer drug, Rituxan, that was used off-label in dermatology. And they wanted to go for the claims, but it's used in rare diseases that are hard to diagnose, and the average patients had seen about 6 dermatologists before they got an appropriate diagnosis. So in order to design a trial that involved an injectable drug that's delivered over the course of a year in a small volume of patients, it was not going to be cost effective to run your traditional trial design. So what we did was we armed community dermatologists with iPads with a telemedicine application on board, and used the PI to do the diagnosis confirmation virtually. So we used telehealth to provide for virtual confirmation. And then we used in-home IV nurses, infusion nurses, to actually deliver the therapy. And the local community dermatologist was also given electronic calipers on their iPads so they could actually measure the lesions, and we could build a library of photographs and videos as the treatment progressed. And this is the way we ended up deploying a trial where the PI never literally saw a patient in person. And in the long run, after the approval, which actually came, I believe, in 2018, the tools of this, the electronic calipers and the telehealth application, it could be used as part of the marketing of the drug with the dermatologist full time. And so that PI could be changed, could take on a new role of moving from PI to nationwide diagnosis confirmer, so to speak, for the rare disease. So those are two kind of unusual ways where we instrumented the trial and did it in a way that had implications both for the commercial side of the equation as well as for the trial itself.
That's fantastic. And the implications are enormous. I think Dr. Lin has already started talking about how she's seeing data that she's never seen before, and that data around this patient engagement with the medication, both the timing and the frequency of the dose, is so critical, because many medications actually rely upon proper timing and frequency for the dosing for them to be efficacious. So Dr. Lin, do you feel like there's a certain, and certainly with Don on the line here as well, given his legal background, but we'll start with you, Dr. Lin, do you feel that there's a certain level of either ethical or regulatory or even potential legal responsibility that researchers have in using these intelligent medication platforms when they do their research with medications that have a timing or frequency dosage sensitivity to them?
Well, I can't really speak to the legal aspect of it, and I do think that what these technologies allow us to do, and I don't run clinical trials, and I will defer to Don on it, is, but certainly for certain clinical trials where, like you said, the medication dosing and or frequency is particularly critical to the efficacy of the medication and or potential side effects that can be associated with the medication, it is really helpful to be able to have a more objective measure of how the patient is actually taking the medication and how often. So I do think from that standpoint, that would be a really helpful tool that could be used in academic research going forward, both clinically trial-oriented or non-clinical trials, for sure.
And would you say it would go beyond helpful to it's ethical when the timing and the frequency of the dosage is critical for the efficacy of the medication?
I mean, certainly if it's critical, I do think that that's a really important thing. I think in my field, which is in primary care and outpatient medicine, that's less of an issue, but I can certainly imagine there are other fields where the timing and dosing is critical. And in that case, I think, the ethics is an important consideration to just factor in as trials are being designed.
Stan, it's interesting how things evolve in the law. We go from new technologies being developed that are interesting, and then physicians and clinicians like Dr. Lin actually put them to work and see how they turn out. And then we start having conversations about, is it ethical to use them? And then we start having conversations about, is it ethical not to use them? And you finally get to the point where you actually end up with conversations where is it negligent not to do something. So for example, if you had a drug where too much or too little of the drug would make a huge outcome difference, maybe even be dangerous, you could make the argument right now today that it's probably unethical and maybe even negligent not to be using some of these technologies to actually monitor. And I know a lot of pharmaceutical companies are not at that point. But I think if I just wear my legal hat, knowing what our capabilities actually are and knowing how dangerous some drugs can potentially be, I would think that the argument is going to be made and sometime over the next decade that in fact it's negligent not to instrument the patient and get more objective measurement.
That's great. And again, we're up on time, and I think we could really have this conversation on the next symposium around opioids. I think we've seen what's happened when, Don, you bring up the point, is it negligent that opioids were distributed throughout the United States without having these medications managed through some sort of electronic means? And that's a debate that I think the digital health community, the medical community, the regulatory community in the United States could certainly stand to have to understand how that would happen. Certainly at the lab, at HITLAB, we're working with life science companies right now on testing and pushing forward a lot of these intelligent medication solutions and larger supply chain infused packaging studies to see how far we can take this. And it is a critical thing that's being studied today, and it's working. I mean, there's no real technical barrier. It's more around the human capacity to implement these technologies. They've been around for over a decade now. And so again, Dr. Lin, thank you very much. Dr. Jones, an attorney, of course, Dr. Juris, thank you for joining us as well on a regular basis, and a virtual round of applause from our audience from all around the world. Thank you both.
Thank you.
Thank you.
And just incredible debate around those areas, and without a doubt, something that we'll continue to cover here at the lab on a regular basis, and make sure that we're covering to continue the conversation there. But again, an important one nonetheless, particularly during a pandemic.